6 stroke symptoms 1 month before it happens, early detection. Welcome to today's video, where we will explore 6 symptoms that may appear 1 month before a stroke occurs. You've surely heard of strokes, right? Have you ever wondered if your body can give any signs 1 month or even a few months before a stroke happens? If you experience any of the symptoms I'm about to share in this video, don't hesitate to visit your doctor immediately, as they could be signs of an impending stroke. These symptoms may appear as early as 1 month before a stroke, and a delayed diagnosis increases the risk of severe brain damage. Stroke does not discriminate by age, gender, or health status, even in young or healthy individuals. Cardiovascular diseases are on the rise globally, including among the younger population. It is the leading cause of death in the United States, where more than 795,000 people experience a stroke every year, and nearly 159,000 people die from it annually. Stay with me, as today we will explore the 6 symptoms that may appear 1 month before a stroke occurs. You will learn how to prevent this disease and avoid becoming part of these shocking statistics. To illustrate, many signs appearing 1 month before a stroke are subtle and often overlooked, leading to misinterpretation. Recognizing these signs is crucial. Regardless of age, health status, or any underlying conditions, a stroke can happen to anyone, so always stay alert. Sharing this video with family and friends could save many lives. Additionally, I will clarify the difference between ischemic and hemorrhagic strokes, helping you understand these two conditions better. I will also explain brain aneurysms and their warning signs, as well as transient ischemic attacks, TIA, which can precede a stroke. Recognizing these symptoms correctly could save your life or the life of a loved one. If someone in your family has had a brain aneurysm, it is important to consult with a reputable neurologist even if no symptoms are present. Taking this proactive step is crucial for early detection of potential brain problems. Now, let's explore the 6 symptoms that can appear a month before a stroke. If you experience any of these symptoms, make sure to visit a doctor as soon as possible. Symptom number 1. Persistent high blood pressure. Persistent high blood pressure is one of the most important warning signs before a stroke occurs, and if left uncontrolled, it can lead to extremely serious consequences. To understand this better, we first need to know what blood pressure is. Blood pressure is a measure of the force that blood exerts on the walls of blood vessels each time the heart beats. Blood transports oxygen and nutrients to the body's organs, and this process needs to occur continuously and steadily. However, when blood pressure rises beyond normal levels, also known as hypertension, it creates excessive pressure on the blood vessel walls. This is the cause of damage to the blood vessels, making them weaken over time, which can lead to narrowing or even rupture of blood vessels. High blood pressure is one of the primary causes of many dangerous complications such as stroke, heart disease, and kidney disease. One of the most serious issues that high blood pressure can cause is a stroke. When high blood pressure persists, the blood vessels in the body, especially the ones in the brain, are subjected to significant pressure. If a blood vessel in the brain ruptures due to high blood pressure, this phenomenon is called a hemorrhagic stroke, and it can lead to severe brain damage, even death, if not treated promptly. When blood vessels rupture, blood leaks out and causes hemorrhaging in the brain, leading to a lack of oxygen and nutrients to the brain, which severely affects brain functions. Additionally, high blood pressure can damage the arteries that supply blood to the brain, reducing blood flow to critical areas of the brain. When blood flow is reduced, brain cells do not receive enough oxygen and nutrients to function, leading to a condition known as cerebral ischemia. In this case, if the blockage or reduced blood flow continues for an extended period, it creates favorable conditions for blood clots to form. These blood clots can block arteries in the brain, leading to an ischemic stroke. Ischemic stroke is the most common type of stroke, occurring when a part of the brain lacks blood due to blockage, resulting in brain cell damage. Therefore, controlling blood pressure is extremely important to prevent these dangerous complications. If blood pressure is not well controlled, the risk of stroke increases significantly. To maintain stable blood pressure, you need to adopt a healthy lifestyle and implement preventive measures. Reducing salt intake in your diet. Eating a balanced diet with plenty of fruits, vegetables, whole grains, and low-fat, low-cholesterol foods, combined with regular exercise, are important factors for keeping blood pressure stable. Additionally, if you have been diagnosed with high blood pressure, it is crucial to follow your doctor's instructions and take medication as prescribed. Your doctor may prescribe antihypertensive medications to help control your blood pressure effectively. It is important to regularly monitor your blood pressure to ensure that it remains within normal limits and to prevent prolonged high blood pressure from going untreated. Therefore, maintaining stable blood pressure not only helps protect your health but also plays a crucial role in preventing dangerous conditions such as stroke. If you notice any signs of rising blood pressure, do not hesitate to consult your doctor immediately for advice and timely treatment. Taking care of your health starting today will help you prevent serious risks in the future. Symptom number 2. Excessive fatigue. Excessive fatigue is a common symptom, but it's often overlooked. However, it could be a warning sign before a stroke. Fatigue is sometimes normal after a long day of work or after intense physical exertion. However, when you experience persistent fatigue without a clear reason, especially if this level of fatigue is different from what you normally feel, it could be a serious sign that you should not ignore. Unusual fatigue may indicate an underlying health issue, particularly blood circulation problems, including stroke. One of the reasons excessive fatigue may occur is a change in blood flow to the brain. When blood flow is reduced or temporarily stopped in a part of the brain, the body responds by causing feelings of exhaustion. This could be a sign of a transient ischemic attack, TIA. TIA is a condition where blood cannot reach a part of the brain for a short period, usually from a few minutes to a few hours. Although this condition is brief, it can serve as a warning of a potential stroke. When a blood clot or blockage affects the blood flow to the brain cannot receive the oxygen and nutrients it needs to function properly. This causes brain cells to temporarily lack energy, leading to symptoms such as extreme fatigue, dizziness, and a feeling of being unable to perform normal tasks. This is a critical warning sign that not everyone may recognize. Sometimes, extreme fatigue may not only be a sign of TIA but could also be a warning before an actual stroke. Prolonged lack of blood to the brain can lead to an ischemic stroke, in which part of the brain is deprived of oxygen, and brain cells begin to die, causing permanent brain damage. To avoid this risk, you need to pay attention to early warning signs and not delay seeking help if you experience unusual fatigue. Excessive fatigue can not only occur due to cerebral ischemia but also from a general reduction in oxygen supply to the body, affecting your overall health. When the body feels fatigued, it is a way for the body to protect itself by halting unnecessary activities and restoring energy. However, if this symptom persists without a clear reason, it's essential to get a medical checkup to determine the cause and treat it promptly. If you notice fatigue without a clear reason, especially if it's accompanied by other symptoms such as severe headaches, numbness or weakness in the muscles, balance issues, or difficulty speaking, you should seek immediate medical care. These signs may indicate a serious medical condition, and early diagnosis will give you the opportunity for timely treatment, preventing the risk of stroke or other brain-related issues. Therefore, if you feel unusual fatigue, pay attention to it and don't hesitate to visit a doctor. Early diagnosis and timely treatment are the best ways to protect your health and avoid serious risks in the future. Symptom number 3. Vision problems. Vision problems can be one of the warning signs of a stroke. And if you experience any sudden changes in vision, you should not ignore them. Blurred vision, double vision, or difficulty focusing on objects could be a sign of blood vessel damage in the brain and could be a serious warning related to a stroke. When a stroke occurs, it can affect blood vessels in the brain, leading to disrupted blood flow to areas of the brain responsible for functions such as vision. If the blood vessels are blocked or damaged, it will reduce the blood flow to these areas, causing vision problems. Specifically, symptoms like blurred vision or double vision may appear suddenly and last for a short period, typically indicating an ischemic stroke. The most common type of stroke. An ischemic stroke occurs when there is a blockage in the arteries supplying blood to the brain, causing blood to be unable to reach parts of the brain, including those areas responsible for vision. When blood flow is interrupted, brain cells do not receive enough oxygen and nutrients, which decreases their ability to function. including the ability to control vision. This can cause blurry vision, difficulty seeing clearly, or double vision. Additionally, vision problems may be related to damage in smaller brain arteries or specific brain areas that control vision functions. This is why if you suddenly experience vision issues without a clear reason, such as double vision, trouble focusing on objects, or blurry vision, you need to stay alert and seek medical care immediately. Not all vision problems are related to strokes, but if this symptom appears suddenly and is accompanied by other signs such as paralysis, difficulty speaking, or balance loss, you should go to the hospital immediately for diagnosis and treatment. These signs could indicate that you are experiencing a serious health issue, and early identification and treatment can help limit damage and prevent serious complications. Symptom number 4. Sudden and severe headache. A sudden and severe headache is one of the critical warning signs before a stroke occurs, and it is a symptom that should be taken very seriously. In particular, these headaches differ from ordinary headaches because they occur suddenly, are intense, and are unlike any headache you've had before. In the case of ischemic stroke, the headache occurs due to a blockage in the blood vessels in the brain. When a blood clot or a cholesterol plaque blocks the blood flow to the brain, it creates pressure in the blood vessels and reduces blood flow to brain cells. When the brain doesn't receive enough oxygen and nutrients, it can lead to headaches, often accompanied by a sensation of tension or pressure in the head. The headache from an ischemic stroke may occur along with other symptoms, such as dizziness, difficulty speaking, or partial paralysis of the body. In the case of a hemorrhagic stroke, the intense headache occurs due to the increased pressure in the brain caused by bleeding. When a blood vessel in the brain ruptures, blood leaks into the brain tissue, causing a hemorrhagic stroke. This creates significant pressure within the skull, compressing brain tissue and leading to severe headaches. These headaches are often described as sharp and may be the most intense pain the person has ever experienced, and they may not subside even with pain-relieving medications. Headaches in hemorrhagic stroke may be accompanied by other serious symptoms, such as loss of consciousness, vomiting, or seizures. If you experience a sudden and extremely severe headache, especially if it differs from any headaches you've had before, you need to go to the hospital immediately. This is an extremely important sign that may indicate you are dealing with a dangerous stroke condition. While headaches can have many causes, when accompanied by symptoms like paralysis, loss of speech, or blurred vision, you need to be aware of the risk and seek medical help immediately. A sudden and severe headache is a sign of a sudden change in the body, and it is essential not to be complacent. If you notice that your headache is unusual, don't delay. Go to the hospital for timely examination and diagnosis. Symptom number 5. Sudden numbness or weakness in limbs. Sudden numbness or weakness in the arms, legs, or one side of the face can be a very serious warning sign before a stroke. These symptoms usually appear when there is a disruption in blood flow to the brain, and they may indicate a transient ischemic attack, TIA, also known as a mini-stroke. In a TIA, blood cannot reach part of the brain for a short time, usually from a few minutes to a few hours. While TIAs do not cause permanent brain damage, they serve as a strong warning sign that a real stroke could be imminent if not treated promptly. When blood is not adequately supplied to certain parts of the brain, symptoms like sudden numbness or muscle weakness appear on one side of the body, such as in the arm, leg, or face. Sudden numbness or weakness on one side of the body can occur suddenly and is one of the most common symptoms of stroke, especially if these symptoms appear without a clear reason or last from a few minutes to several hours. You need to seek medical attention immediately. While the symptoms may subside after a short period in the case of TIA, it is crucial to recognize that this is a warning sign that the body is experiencing a serious issue with blood circulation in the brain. Even if the symptom lasts only a short time and then resolves, there is no guarantee that this condition will not recur or lead to a more serious stroke. If you experience sudden numbness or weakness in the arm, leg, or face, especially if accompanied by other symptoms like difficulty speaking, loss of balance, or blurred vision, you should go to the hospital immediately for diagnosis and treatment. These symptoms are signs of a very dangerous condition that can lead to a stroke and long-term brain health issues. Therefore, do not be complacent and always seek medical care when these signs occur. Early diagnosis and timely intervention are key to minimizing brain damage and preventing a severe stroke. Symptom number 6. Speech problems. Speech problems are one of the key warning signs of a stroke, and they can appear suddenly in individuals about to experience a stroke. A person with this symptom may suddenly find it difficult to speak, which may manifest as slurred speech, difficulty expressing words, or even being unable to complete a sentence. This is a sign of a condition known as aphasia, a disorder that affects the ability to understand and produce speech. Aphasia is a language-related issue that occurs when the brain regions responsible for controlling and processing language are affected. When a part of the brain doesn't receive enough blood due to a blockage or disruption in blood flow, those areas can become damaged, leading to difficulties with pronunciation or understanding speech. This causes the patient to have trouble trying to speak or understand what others are saying. Symptoms of aphasia can vary widely, but they typically include issues like slurred speech, difficulty finding the right words to express ideas, or an inability to complete a sentence. Sometimes, the patient might say words that don't make sense, making their speech hard to understand. A person may also struggle to understand what others are saying, even though their hearing and cognition remain intact. If you or someone close to you suddenly experiences difficulty speaking or understanding speech, it could be a warning sign that a stroke is imminent, particularly if these symptoms appear suddenly and cannot be explained. You should go to the hospital immediately for an evaluation. Early identification of aphasia can help you intervene promptly, reducing the risk of severe brain damage and potentially helping to restore language function. It is important to note that aphasia does not always occur with every stroke. But if this symptom appears along with other signs like paralysis, muscle weakness, or vision problems, immediate action is necessary. Make sure that you or your loved one receives medical care promptly to minimize risk and help the brain recover quickly. Difference between ischemic stroke and hemorrhagic stroke. Ischemic stroke and hemorrhagic stroke are two major types of stroke, but they differ significantly in terms of their causes and effects on the brain. Ischemic stroke, the most common type, occurs when part of the brain does not receive enough blood due to a blockage in the arteries supplying blood to the brain. This blockage is usually caused by the formation of a blood clot, also known as a thrombus, or cholesterol plaque in the arteries, preventing blood from flowing through smaller brain blood vessels. When blood flow is interrupted, brain cells do not receive the oxygen and nutrients needed to function, leading to brain damage. On the other hand, a hemorrhagic stroke occurs when a blood vessel in the brain ruptures, causing blood to leak into areas of the brain where it shouldn't be. When a blood vessel bursts, blood leaks out and creates pressure inside the skull, damaging the surrounding brain tissue. This type of stroke is highly dangerous because it not only reduces the amount of blood reaching brain cells but also causes damage due to the bleeding inside the brain. Although both types of strokes result in significant brain damage, ischemic strokes are more common and can lead to long-term consequences such as loss of mobility, speech difficulties, or memory impairment. Hemorrhagic strokes, while less frequent, have a higher mortality rate because the blood entering the brain can increase pressure in the brain, leading to more severe damage. How to prevent a stroke. To prevent a stroke, it is crucial to manage risk factors effectively. First, you need to control your blood pressure, as high blood pressure is one of the main causes of strokes. Maintaining an ideal weight and following a healthy diet, which includes eating plenty of vegetables, fruits, whole grains, and minimizing processed foods high in fat and sugar, is also important. Additionally, regular exercise is crucial because it improves blood circulation and reduces the risk of blood vessel blockage. Limiting alcohol consumption and avoiding smoking are also important factors in reducing stroke risk, as they can increase blood pressure and harm blood vessels. Moreover, if you have any risk factors such as diabetes, high cholesterol, or a family history of stroke, you should schedule regular checkups and follow your doctor's advice to minimize the risk. These simple steps can help protect your health and prevent a stroke. I hope you now have a clearer understanding of the symptoms of a stroke. Please share this video to help save the lives of your loved ones and friends.